7, Group 2. We are here to present a case on apparent life-threatening event. Let's begin with the character introduction. The mother, father and their son, nurse, resident, the 2 PGIs and the 2 interns. Let's begin. In this presentation, we will be demonstrating a case of an apparent life-threatening event or ALT. This refers to a sudden and unexpected episode in an infant that is alarming to the observer. Through this clip, we aim to illustrate how an ALT may present, the immediate response of caregivers, and the appropriate medical evaluation and management. Scene 1. This scene takes place in a quiet home setting. It's a routine afternoon for the mother caring for her 8-week-old baby. As she breastfeeds him comfortably in her arms, the calm moment is interrupted by an alarming event.
There you go, sweetheart. Nurse well. That's it. Such a good boy.
Suddenly, the baby pulls away from the breast and spits up. He begins gagging.
Are you okay, baby? Are you okay?
What happened?
He's not breathing. His lips are turning blue. No, baby. Please come on. Please breathe. Baby, please breathe.
After a tense few seconds, the baby gasps, starts breathing again and begins to cry softly. His lips regain color.
Oh my God. Thank you. You're okay?
Is he okay now? Is he okay now?
Yes, he's okay. But he stopped breathing for a minute and his lips turned blue.
Okay, let's go to the hospital now.
Okay.
They gather the baby and baby bag quickly. The mothers host the baby securely while the father grabs the phones and keys. They exit the house visibly shaken. Scene 2. The mother and father are waiting in the pediatric clinic, anxious to have their baby, who is calm now to be seen after a frightening episode.
Mr. and Mrs. Khan, the doctor will see you. Hello, please have a seat.
So what brings you here today?
Doctor, my baby stopped breathing suddenly, doctor, after I breastfed him early today. He spit up black and then he went quiet. His lips turned and I have to stay with him, doctor. After a minute only he started breathing again, doctor.
We got so afraid and we came here after that.
I understand how frightening that must have been for you guys. As now he looks stable, that's good. But what have you said, the symptoms, the gagging, the screaming out loudly, discoloration and breathing difficulty? I think it's safest to be sent him to the ER for immediate evaluation.
Something serious, doctor?
As of now we can't say anything because infants in this age, particularly in stage group, they face brief events like this and they recover quickly. But we have to find out the underlying issues that cause it. So I'm sending him to the ER. They will do a full assessment. So don't worry.
Understand?
Can you take it? Yeah, take it to the emergency department.
Scene 3. The family is now in the emergency department, where a PJ begins a thorough evaluation.
Hello, we are the pediatric interns here. I understand you had a very scary day today. So we like to ask a few questions and examine your baby. Is that okay?
Can I confirm your baby's full name, please?
Baby Shah Khan.
Is your baby a boy or a girl? A boy, doctor. How old is your baby? He's just 8 weeks old. And you are?
We are his parents, Mr. and Mrs. Khan.
Okay, can you tell me what happened? Yes, doctor. I just fed him and I was holding him like this. Suddenly he stood up and gagged, kind of gagged. And then he went quiet, doctor. His lips turned blue and suddenly he stopped breathing, doctor.
Okay. Can you tell me if your baby was awake, drowsy or asleep before
He was
this?
awake, doctor.
Did it look like he was choking or did he fully stop to breathe?
He fully stopped breathing, doctor. No, it's okay.
For how many seconds or did it last?
For a minute, doctor.
Okay, you said he turned blue. Was it only around the lips or the total body turned blue?
Only around the lips.
Was he stiff like his arm or leg became tight or stretched out? Any change in the tone?
No, doctor. I didn't notice any change. was same as before.
Okay. Did he seem drowsy or completely unresponsive?
He went completely unresponsive for a moment.
Did you do anything to help him recover?
Yes, doctor, I kept stimulating him, kept calling his name. Then only he was back on.
Did you vomit or spit up the milk or mucus after that?
No, doctor. After episode, still not nothing.
Did your baby seem confused or off balance after the event, like he had a seizure?
No, doctor, he's not.
Was your baby sick before this happened? Was anyone around your baby sick recently? Any infection, BP, diabetes or medication during your pregnancy? Was your baby born a full term or early?
He's a full-term boy, doctor.
How was your baby fed? Breastfeeding or formula feed or
I
formulation?
only breastfeed now.
Does your baby spit up often after feeds?
Not often, only sometimes, but this is the first time he split up and stopped breathing.
Does your baby seem irritable, active back or cry a lot after feed? Did your baby receive BCG, HPV vaccine at birth?
Yes, doctor.
At 6 weeks, did your baby get the first dose of DTP, OPV and HIV vaccine?
Yes, doctor. Yes, doctor.
Does anyone in the family have seizure, epilepsy or developmental delay?
No, doctor.
Any family history of heart problem or sudden death?
No, doctor. Nothing like that.
Did any baby in the family have trouble right after birth?
No, doctor.
Has your baby started smiling socially, following object with their eyes, cooing, recognizing your voice, or lifting their head during tummy time?
Yes, doctor. He did all the things you said.
Does anyone smoke in the house?
No, doctor.
Are there any medication, cleaning agent, or chemical kept within the baby's reach?
No, doctor.
Is there anything else you feel I should know, or do you have it covered it?
No, doctor.
I appreciate you for answering all the questions. Now I'll do a quick physical examination. Is that okay?
Okay.
Can you please remove the clothing to check for the skin and belly and for chest examination? Examination are in the normal limits, and there is no signs of respiratory distress, and the cardio findings are normal, and the baby is neurologically active and alert.
Let's keep the baby under observation for 24 hours and please admit the baby to the observation area and also monitor the vitals, feeding pattern and any symptoms that recur. Okay, doctor, let's set up the observation chart.
So we have to stay here for a day.
Yes, just to make sure that everything is under control and it's just a precautionary. We'll review everything tomorrow and we'll discuss the case with our seniors also.
Okay, doctor.
Scene 4. While the infant is under observation in the emergency department, a PJ and co-intern step aside to clinically reason through the case.
Did you see the case today?
Yeah, there is a single brief episode of apnea and perioral cyanosis right after right after feeding. But the small gagging and small amount of spit up, but the baby has recovered spontaneously under a minute. So what's on your differentials?
Okay, the first thing that came to my mind is GER because the event occurred after the post feed and it involved gagging and spitting up. And we should not stick onto it, we should think broadly.
Then what about swallowing dysfunction?
Yeah, good thinking. Swallowing dysfunction also shows the similar episodes that the patient will have gagging, apnea and cyanosis, like particularly after the feeding. But in our patient, there is no history of recurrent choking or coughing or wet voice, refusal of speech, and also the neurological examinations are normal and there is no hypotonia noted. So swallowing dysfunction is ruled out.
If we are still suspicious, we can also do a follow-up study like video fluoroscopy or micro-optic endoscopic evaluation study. But right now, I think it's low on the list.
And also then there is intersusception, which is a classic pediatric emergency.
But that usually presents episodic abdominal pain, baby draws up the leg, inconsolable crying and vomiting, right?
Exactly, and also sometimes with current jelly stools, but none of it was present here, and also the abdomen findings are normal, so it is unlikely.
Yeah. But what about the valvulus due to malrotation?
Yeah, okay. While thinking about valvulus, usually it will show up bilous vomiting and some sites like episodes of shock and the abdomen will be distended. But in our case, the baby's abdomen was soft and non-distended. So volvulus is unlikely to the case. And if at all, if the baby has like volvulus or malrotation, we need to do a upper GI contrast study to rule it out.
Makes sense. So with all that considered, GERD still seems most likely.
Exactly. And interesting part is this, it is not only a simple reflex, it is GR-induced laryngospasm.
Oh, laryngospasm? Can you explain the mechanism again?
Sure. So the gastric content reflects to the esophagus and in the esophagus, in some sensitive infants, it will stimulate the laryngeal chemoreceptors and that activate the vagally mediated reflex, that is the reflex triggered by the vagus nerve and it causes the vocal cord to shut up. And this is called laryngospasm and it is a protective mechanism that prevents aspiration and in doing so it also causes the airway to obstruct. And due to the obstruction of airway, there will be like apnea and bradycardia and that leads to cyanosis.
Yeah, that explains perioral cyanosis and why the baby stopped breathing.
Exactly. And the infants are really vulnerable and their esophagus motility is also very immature and they always lie in supine position after feeding and their diet is only liquid and this increases the reflex.
So we are calling as an apparently life-threatening event secondary to gastroesophageal reflex associated with the laryngospasm.
Exactly, and that's the working impression as of now. And if there is no red flags and any other reoccurrence of any symptoms, we will continue with the conservative management like thickening feeds and changing the lacting position.
I see. It's fascinating how the protective reflex can make such a dramatic clinical presentation.
Exactly, pediatrics keeps you on your toes.
The baby remains stable during this period, but the team is focused on ensuring that no serious condition is missed. Scene 5. While the infant remains under observation in the emergency department, the PJ provides an interim update to the resident doctor.
So this is the infant earlier with the post-feed apnea and cyanosis.
Yes, doctor, and I just wanted to update you that the baby has been under observation for 24 hours.
Okay,
And the baby has been fed for 3 times and on one occasion we noted a reflex and a gagging up and split up and other than that the vitals are normal and there's no apnea or cyanosis noted.
okay, that's good, a bit reassuring. But if the symptoms recur, especially apnea and if it's post-feed, we need to broaden our workup. Okay. So first we need to do thorough history and physical examination, which we've already completed, and that's good. And if the reflex symptoms recurs again, we have to start 24-hour PH monitoring. But it's a bit invasive, though it's about standard. If it's a non-acid reflex, we can start considering the multi-channel intraluminal impedance. And if respiration is also a concern, we might do swallow study or even a random swallow. Okay.
Understood, doc. We'll keep that in mind if the feeding symptoms reoccur.
Okay. So to rule out the other causes like cardiac and neurologic like seizures, we need to broaden our workup again, and we might start considering the ECG, EEG, and even the labs to rule out the infections, anemias, and metabolic issues.
Sure.
So this is likely, hopefully it's an uncomplicated GERD-induced laryngospasm. So, but the infants with apnea as a symptom, we should keep a close watch. Okay? Sure.
Scene 6. After 24 hours of continuous observation in the pediatric unit, the infant has tolerated multiple feeds with only occasional reflex episode and no recurrence of apnea.
So how is the baby doing after the observation?
So after 24 hours observation, the baby has been fed for more than 10 times and there is no reflex, in occasion there are 3 times a reflex and mild gagging up, and there is no signs of apnea or cyanosis noted at all, and there is no change noted in tone, and everything seems normal at all.
Okay, so there is a reflex intermittently, but there is no alarming episode.
Exactly, doc. There is no aortic episodes or desaturation. The baby seems to be active and the vitals are normal.
So yes, we are ideally dealing with an uncomplicated GER. So how will we proceed?
Conservative management law.
Yes, advise the parents to feed the baby in small frequent feeds and ask them to keep the baby upright for at least 20 to 30 minutes after each feed, and ask them to make them work frequently. And while sleeping, ask them to put the baby on his back. Okay? And there's no need for pharmacological therapy now because there's no recurrence. And teach the parents how to recognize the red flag symptoms. Okay?
Sure. We'll consult the parents.
Okay. And schedule a review in 48 hours or sooner if the symptoms occur again. Okay?
Okay, doctor, sure.
Scene 7. Before discharge, the PJ gently explains a few important measures to help the parents care for their baby and prevent future issues.
Okay, great news. The baby is completely normal and doing well. So before discharge, I like to share some safety measures to prevent this from coming again. So firstly, you should feed frequently in small amounts, and after that burp him often and keep him in an upright position for about 20 to 30 minutes and place him on his back to sleep, and no smoking around the baby. And if at all the symptoms reoccur, or if the baby having difficulty in breathing or the skin, the color of the skin changes, bring back him immediately. We will take care of him, and we have scheduled the appointment after 48 hours. Okay.
Okay, now thank you. I will follow the instructions. I was so scared. I thought I was losing.
No, you did the right thing and your instinct saved your baby.
Thank you.
Scene 8. 2 days after discharge from observation, the infant returns for scheduled follow-up at the outpatient department.
So how's the little one doing now?
Much better. There are no more episodes of split up and baby problem since we got home.
Okay, so were you able to follow the feeding and positioning instructions given?
Yes, doctor, we've been following the small frequent feeds and then we keep the baby upright as you advised.
Good. So there's no gagging, no discoloration or breathing difficulty? Good. So it seems that the conservative management worked, and there's no need for medical therapy now since there's no recurrence of the symptoms. But if it reappears, we need to start considering the medical therapy. Okay. So for now, just continue what you're doing, the conservative management, and make sure you follow the instructions given. Okay.
Thank you so much, doctor.
Thank you, and don't hesitate to come back if something happens. Thank you.
Reassured by the baby's progress, the resident reinforces the importance of vigilance and advises prompt return if the symptoms reappear. What matters is that we recognize the signs, evaluate carefully, reassures family, and teach safety. 1 minute can feel like forever, but knowledge lasts a lifetime. Let's move on to the brochure explanation. begin by understanding what ALTE means. ALTE stands for Apparent Life-Threatening Event. It's a term used when a baby has a sudden unexpected episode that seems very frightening to the person who sees it. This might include the baby stopping breathe for a few seconds, turning blue or very pale, becoming limp or stiff or even choking. Now, I know it sounds very alarming and naturally worries any parent or caregiver. But here is the important part. Many times it looks scary but isn't necessarily dangerous or life-threatening. In fact, most of these events resolve on their own and don't always mean something serious is wrong. So, while we should take ALTE seriously and seek medical help, we also want to reassure you that most babies recover well. Let me explain the same concept a bit deeper. ALTE is described as a sudden episode of an infant that alarms the caregiver. This could be because the baby stops breathing for a few seconds, turns pale or blue, limp becomes stiff, or appears to choke. As a parent, it's natural to panic in such situations. But remember, many times it passes quickly and doesn't indicate a major illness. That said, we always advise getting your baby checked if this happens just to be safe. So, how do we know it might be an ALTE? Here are the signs to watch for. Baby suddenly stops breathing and the skin colors change, turns pale, blue or dusky. Changes in muscle tone. The baby may go limp or become unusually stiff, gagging or choking, crying or unusual movements just before or after the event. The baby may appear unresponsive for a short time. Now let's talk about the possible causes of such episode. Firstly, acid reflux. The milk may come back from the stomach and enter the airway, causes choking. Next, breathing difficulties. For example, due to a cold, blocked nose or mild infection. And next, seizure. It's less common but something we always evaluate for. And heart problems. It's rare but can be a cause. And sometimes no cause is found. That's frustrating but it happens, and even in those cases, baby often just do fine. Next. So if you witness such an event, what should you do? First, stay calm. I know it's easier said than done, but your calm response is the key. Next, gently stimulate your baby. You can tap the foot or rub the back to see if the baby responds. Then rush to the hospital immediately. Don't wait or try to figure it out alone. And very importantly, tell the doctor everything you saw. What exactly happened, how long it lasted, and what did the baby look like afterward, and was the baby breathing, crying or active after the event. All this helps the doctor understand the situation better and make the right decision. Next, once you reach the hospital, here's what to expect. First, the doctor will ask you about the event in detail. So please try to recall everything you saw. The baby will be examined and monitored. We check breathing, heart rate, oxygen levels and so on. Depending on the case, tests like ECG, X-rays and blood tests may be done. The baby may be observed for up to 24 hours, especially if we find a possible cause. Most importantly, most babies go home safely after this. The observation is mainly to ensure the baby is stable and there is no immediate risk. Okay. Lastly, let me answer some frequently asked question we get from parents. Can ALTE happen again? It depends on what caused it. If you find a cause and treat it, the chances go down, but your doctor will guide you based on your child's case. Is it dangerous? It can be, but not always. What makes the difference is how quickly you respond and seek help. How can we prevent it? Always practice safe sleep. Place your baby on their back to sleep, not on the tummy. Feeding upright and burp well to reduce choking. And do not skip your regular checkup with a pediatrician. These small steps can make big difference. Okay, let's wrap up. ALTE can be very scary experience for any parent or caregiver. But staying calm and acting quickly is the key. Seek medical attention immediately and follow the advice of the healthcare provider. The good news is most babies recover well and safely.